Yearly, like we mentioned, which is the reason why we are making this presentation, we know facilities don't do budget proposal. But because of lack of involvement of nurses, some basic items are not, imputed in the budget proposal. Big items that probably are not the ones that are very much crucial in the management of the patient in the wards are not included. So, the ward in charge should, as a matter of responsibility, itemize all the needed basic items, such as blood pressure apparatus, thermometer, bed sheets, blankets, Macintosh, drip stand, wheelchairs, stretchers, etc. as part of their budget proposal. It will interest you to know that in most hospitals, these few items that I've mentioned, like the wheelchairs and stretchers, find it not very much available in the hospital. So sometimes you see how difficult it is to lift patient from one ward to the other, or from one point of consideration to the other. So it's because we are not always keen on making sure that these things are available. It is equally important to document all the damaged items in the ward for submission to the top management through the hospital or facility head of nursing services. You see, it will not be the fault of the management if you didn't report that you need so number of stretcher, or you need so number of BP apparatus, or you need so number of monitors. If the management are not aware that we are in need of this, how can they provide? And another thing, just like we've mentioned here, we don't document things. Why can't you document what you need? When you document and submit to the management, it will now be easy for you to do follow-up, referencing that documented items that you've sent to the management. So this is why it is very important that we look at some of these things. Prepare a ward budget for inclusion in the budget proposal for facilities. As a nurse in charge of the ward, involve several steps. Of great importance is the role of other nurses in the ward in the budget proposal, so that other useful items can be included in document. Here, when we now agree that we need to be part of budget proposal, don't just do it alone as a ward in charge. Involve other subordinates in the ward. Involve your colleagues in the ward. What are those things that we need that are not present? They will help you in itemizing those things, and then you forward to the management. Now let us look at a step-by-step guide towards preparing a budget during the hospital's yearly budget preparation. Like we said, we want our members to be conversant with how do we prepare budget. If you now we are advocating for you to be involved in budget preparation, but you need to understand the step-by-step how to do that. So now we are going to look at the step-by-step process. Now, step one. Number one, gather data. If the hospital had involved the nurses in the previous budget proposal, there is the need to review the previous year's budget and actual expenditure to identify trends and areas for improvement. Like I said earlier on, it is not all the hospitals in Nigeria that are not involving nurses. There are some hospitals that really understand the importance of nurses and they are involved in the budget preparation. So some of those in such hospital, the previous budget presentation needs to be looked at. Then the second aspect is if starting for the first time. Now, if you are starting that budget preparation for the first term, there is the need to include the patient's volume and length of stay. Now, what we mean by this is that in preparing a budget, you need to involve the number of patients that are trooping into the hospital on a yearly basis. Now, let me give a typical example. Maybe in 2024, for instance, or 2025, for instance, you have 200 number of patients that have, enjoy healthcare in your facility. It is possible that in subsequent year, maybe in 2026 now, your projection should be maybe depending on the number of cases that you visit the hospital. Your projection should be much higher than the previous one, and then you prepare your budget towards taking care of those patients. And secondly, how long do they stay? Some patients might stay maybe just 3 days, 4 days, 5 days, 1 week, 2 weeks. You need to, find out how long do some patients, based on their condition, how do they stay? How long do they stay in the hospital? How long? All these things to be considered before your budget preparation. If then identify any change in number of staff from the beginning of the year to the current period under review, so as to inform the management about gaps in staff compared to patient volume in the ward. Now, you might have, maybe in 2025, you have about nurses. Now I'll be specific with nurses. You have maybe, for instance, 90 nurses under you as the HOD, or as in the ward in charge. Maybe you have 30 nurses in your ward in 2025, for instance. But by 2026, the number have depleted due to so many reasons. Maybe some have gone for courses, or maybe some have, we know we are grappling with this Japa syndrome now in Nigeria. Maybe some have gone for greener pasture. You need to, maybe from that 30, the number of nurses that are working in your ward are now less than 30, maybe 20. 10 has, gone out. So it is your responsibility to include that in the budget, that we need such a number of nurses in the ward or in our facilities, due to the fact that some have, migrated. Then step 2, identify the ward needs. Now you need to assess the ward current state and identify area for improvement. For instance, should you, as the ward in charge, what do you need to improve the patient's care in the ward? Maybe in the ward, you have cases of broken windows or doors, damaged fans, air conditioners, oxygen supply, bed sheets, BP apparatus, and what have you. You need to identify what you need in the ward to improve your patient care. Now, these are some of the things that you include in your budget. And then now you have to consider patient care needs, staff development, and equipment requirement. Now, it is not, you are not only going to restrict yourself to just equipments alone. Equally, the staff that are under you, do they need some kind of special training? Do they need some kind of any kind of training to improve their output? Then you prioritize needs based on importance and urgency. Now, in all of this that you have listed, you need to prioritize. Now, out of all these challenges that I've itemized, which one is the most urgent that we need? So you place those ones higher, and then put pressure for budget release on those aspects. Then next is step 3. Now this is the most another important aspect. That is, you estimate the expenses. Now you have itemized all the needed items. You have to now work at the expenses. Maybe in terms of supply, medical and non-medical. You have to divide them, the medical one and then the non-medical one. Then equipment maintenance and replacement. Now before I go to even this one, the medical supply, you have to itemize how much is this going to cost, how much is those non-medical items are going to cost. You need to find out the cost implication and try to propose that this is so amount that these items that we are needing in the world, this is how much it is going to cost the hospital. Then what about maintenance? Now equally, what are equipment, maintenance, repair, and then replacement. Now as part of the budget preparation, you need to find out how many of those equipments that are in the world that have got damage. When you are able to identify this is how many equipments that have got damage, are they repairable? If they are repairable, you can talk about the cost implication. If they are not repairable, then you advocate for their replacement immediately. Because without them, you can't function properly. And you cannot be able to satisfy the quality of care that is expected of you. Then, of course, education and training of your staff. Now, the world is evolving. The healthcare system is evolving every now and then. New innovations are being brought on. You need to be abreast of the new innovations that are being brought on, so that the staff under you needs to go for training. If you don't advocate, if you don't advocate for staff training, most of the time you will not be considered. Unfortunately, what we have discovered during our observation or research about this is that nurses just wait for the management to just consider them for training. No, it doesn't work that way. You have to advocate. You have to identify the type of training needed by your staff and then advocate to the management. In fact, it will be good if you are able to move out and find out where such training is taking place in Nigeria or anywhere. Identify those places. How much will it take for maybe social number of nurses to be sponsored to attend such training? And then, write to the management for sponsorship of those nurses that are working under you. Because nobody will consider you if you just sit down and then expecting the management to now come and consider you for training. Or in another way, you need to advocate for budget in your hospital, specific budget for training in your hospital. Though it is available in the ministry, but if the hospital did not, prioritize maybe training of nurses or sponsorship of nurses for training, nobody is going to look at them. It will be other professionals to just be, going for the training while your members are not. You have to push for training of your members, for training of the nurses that are working in there to improve their capacity. And again, there are some donor agencies in the course of our findings. There are some donor agencies that are even looking for proposal, that are expecting proposal on how to train nurses. If you don't write, or if you don't seek clearance from your hospital to write to such agency, or to such donor agency, those donor agencies cannot just come and involve the training of nurses. Though sometimes they do come, and then maybe due to some outbreak of some diseases, they just include nurses in some training. But what we are saying here is that nurses need to include a proposal that, okay, our members need so number of training. Is there grant for the training of such on so specific educational training for the nurses? So of course, these are something that you can input in the budget proposal. Then miscellaneous. The miscellaneous may be traveling to somewhere, maybe something is happening somewhere in another hospital, you want to travel, you equally make, proposal for miscellaneous, such as travel and then conferences. Step 4, estimate revenue by the ward. Now, in some hospital, you have to identify potential revenue source, such as patient care services. You have to, what revenue can be generated from your department or what have you. But like in our own case here, I think that has been well taken care of by the management. Honestly, it has been well taken care of. Now, equally, then you have to look at whether there are grants that is coming from some donor agencies or funding for some specific programs. You have to consider all those ones. Then step 5, you can now prepare budget proposal. Now, you have to use standardized budget template to ensure consistency and accuracy. There is a standardized way, there is standardized budget template that can be followed. If you are able to follow that standard template, the preparation of budget will not be a problem to you. Then clearly outline assumptions, estimate, and justification for each line item, which we have already mentioned. You should clearly state, this is what is needed, these are the estimates, and then these are the reason for this requirement of each line item. And then, of course, we've equally mentioned earlier on, you have to prioritize essential expenses and identify areas for cost saving. After looking at it, which area can we save some items in order to be able to get what we want. Then step 6, review and revise the budget. After you've been able to write down this budget proposal, you need to, together with the rest of the members of your staff, review the budget proposal with ward staff and stakeholders. Now, for instance, if you are ward in charge, you've written down your budget proposal. First of all, review that budget proposal with the staff around you. Then before going to meet the head of nursing services, and then you can now confidently, review the budget together with the head of nursing services. 2, you revise the budget based on feedback and input. You get that? You revise this based on feedback and input. Maybe you have sent out what is the cost of this item. You have sent some of your staff members to go and price certain items. Now it is your responsibility to hear feedback from them. What are the costs of such items? Can we look at areas where we can get it in cheaper? So you have to, get that input and feedback from the people you have assigned to carry out such assignment. Then ensure the budget aligns with the hospital goals and objectives. Each hospital has goals and objectives. Now, you should not write a budget proposal that goes out of the hospital goals and objectives. There are some hospitals that have some specific goals. If you are writing a budget that is outside the goals and objectives of that hospital, you will not, get a good response. Then step 7, you can now submit and monitor the budget. After writing the budget, after going through all the revising and reviewing the proposal, you can now submit the budget proposal to the head of nursing services in a hospital. He will further proofread and discuss it with his deputies before final submission to the hospital finance department for inclusion in the hospital annual budget proposal. What we are saying here, what we are doing here is not just for academic purpose. It is something that if we are serious, we can, make it our duty to do it. If, for instance, this hospital adopt or agree to do this, whether there will be no request from maybe the management for you to do this. Let us get it clear. It is now left for you to prove that you need this. For instance, if the HOD, try to make sure that each ward in charge submit the budget needs of each ward to him. Let them try to, carry out this budget proposal, document it and submit to him. If yearly he is submitting from my department, this is our budget proposal. The management will be happy. I believe the management, they want improvement. Any hospital will want, any MD or CMD of hospital or PM of any hospital will be very much interested in seeing that the hospital is improved. If they've been spending on some items that before, they are just, rewriting previous budget just without the input of the nurses. If the nurses are now taking it as a challenge on themselves to write the budget proposal, present it to the management, and this is what we need, this is what we need, I'm very sure most of the CMDs, MDs, or PMOs will be very happy to begin to include nurses in budget proposal. But if you just sit down and then we just complain, we are not being included in budget proposal, nobody will consider you, and then you day in, day out, your nurses working under you will just suffer. They will keep on improvising the equipment that they need to function properly, and that is not good enough for our image. For instance, if you discover a word that no BP apparatus, nobody will be too happy to come and see that BP apparatus, the BP of patient has been recorded. And this is where we need the issue of nursing audit, because the nursing audit will equally help in making sure that some of these things are, they will challenge the hospital to provide some of these things when they move around to discover that some of these items are not available or some of these things are not being carried out. The nursing audit will be able to identify that. Then monitor and track expenses throughout the year to ensure adherence to the budget. Now you have to do what is called budget tracking. In your proposal, what you have itemized to be provided for the proper functioning of the wards, you go and meet the management or the authority concerned or the stakeholders concerned. That what about these things that we've mentioned that they are not available? Where are the money for it? We need it. You don't just submit budget proposal and then just go and relax. You must have it. Either you create a kind of 3-man committee or 5-man committee that will track that budget. Okay, this thing will forwarded to the top management for consideration. Where are they? Then make adjustment as needed to stay on track. You need to make adjustment if after you carry out your budget tracking and then you discover that some of these things are not available. You need to go and then see why are they not available. It is very, very possible that maybe the MD or the top management officials will inform you that, okay, we don't have money for this. And since we don't have money for this, we can't, buy item A, B, C. Then you can now, look at those items that are equal of importance, but are of less cost. They are of less cost to which one the management are unable to provide. And then you replace those items with the lesser cost items. I hope we are following. Now, by following the above steps and guide, nurses can prepare a comprehensive and effective work budget that support high quality patient care and efficient operation, which can go a long way in showcasing a documented evidence that nurses deserve inclusion in budget proposal. Nurses should not continue to just lament about their non-inclusion, despite their importance in the healthcare delivery, but should rather clearly prove that they can be relied upon in providing the much needed input in budget proposal. Just like we've earlier mentioned, if you are able to, let us not look at it as something very difficult. It is not something difficult. Of course, my colleagues, the world in charges, first of all have to buy into this idea, because they may look at it that it is very difficult for them to just sit down and then be doing all this. After all, the hospital will just do there, they will just provide anything. They are already doing the budget proposal. What we are saying is, you that are in the world, you are the one that know those items that you most need. Because if you just allow if you just allow the other people just write budget proposal on your behalf, there is the possibility that they will prioritize some items that are more costly. They are costlier. They are on the high side, so to say, and maybe their need may not be that urgent to you in the world. Well, in the other hand, you are in the world, there are some minor but very basic and essential items that you need to include in the budget, but they have not included it, thereby making it very difficult for you to provide the quality care that is expected of you. This is what we are saying. So don't let our members not look at this whole idea of budget proposal preparation as a very difficult thing. No, it is to help us to build our image for quality care that is expected of us. So by this topic, I want to believe that the hospitals will try and carry out this budget proposal on their own first. Do it on your own, push forward, and make sure that it is accepted gradually. Every year, you will now be involved in budget proposal. But a situation where you just sit down, you just, the people just write what they feel like in the budget proposal for you on your behalf, when some items you needed most are overlooked, it's not the best. Finally, let me conclude this lecture with the following wise saying. 1. Greatness must be renewed from time to time. If you say you are great, you have to renew your greatness. If we say nurses are great, that is one of our slogans. We have to renew that greatness, and you can't renew your greatness by lamentation. You have to prove that you are great. And how do you prove it? You prove by showing that you know exactly what you are doing. And one of the ways for you to know exactly what you are doing is through this budget proposal. 2, Relevance must be earned through hard work and credibility. Now I told you that relevance, if you want to be relevant, you have to work very hard. You have to work very hard. And then one of that working very hard is for you to be serious in how you manage the world and how you manage the one that, okay, we need social items, social items are damaged, you report to the management to provide it. If it is for repair, you take it for repair, you ask them to repair it. You know, be up and doing. Then three, success must be updated like software. If you are succeeding, you must constantly update your success. If you look at now the issue of the website and then software, constantly it is being updated and it is bringing progress. So don't just sit down and say, this is how we carry it out in the years past, and that is the way it should continuously to be. No, you need to improve on what the kind of care you are given. Then two, adapt or fit. You have to adapt to the changing world of healthcare system. If you don't, you will fade. Now, if you look at, I don't want to condemn the issue of this Chu or the Jechu, and you know the challenges that you are facing with some of the subordinates surrounding us. If you don't improve on the kind of care that you are providing, if you don't showcase our professionalism, we will fade. This is what it means. We will fade. We need to adapt to the changing global system of health. Then three, grow or become a story of what could have been. If you don't, make sure that you are growing, gradually other health work professionals will just come and override you. You will have so many challenges of still again, people trying to take over our job. If you don't prove that you are most relevant, gradually people just take over your job. Lastly, change or be replaced. If we don't change our attitude, if we don't change the way we look at things, if we don't change how we look at things, honestly, we can be replaced. Attempt has been made for us, has been made on our being replaced. Though we pride ourselves that it is difficult, but then we have to really work hard to maintain that lead of being responsible for provision of quality healthcare to our people. Let me thank you all for listening. Thank you. That's the end of this lecture. Thank you.
All right, so actually, I'm very grateful for this wonderful presentation. And if I can understand, some of our members, they have some questions, more especially in the aspect of putting up their best to see that they sit down calmly, do their research, personal research, and come up with a very beautiful budgets for their particular wards or units. But at the end, maybe out of 100%, you see that even up to like 10% is not addressed. So some of them, they used to feel that, even if I do it, nobody is going to consider, they will just do what they want. How can you encourage this our staff to tackle that particular issue?
Thank you very much for this question. You see, change does not come easy. If you want to make a change,
Yes.
you have to try it again, and again. Now, when Columbus wanted to discover, the guy that was responsible for discovering America,
Yes.
do you think if he has just stayed at the end of the shore and been looking at the sea or the ocean, will he have crossed to come and discover? No. Look at Mungo Park. the one that they claim discovered River Niger. Do you think if they had just, stayed and then just look at, would they have discovered River Niger? No. Any change that you want to effect is always filled with a lot of challenges. And of course, particularly in this situation of ours, where we are not, considered in policy making, in whatever, mostly our members, our nurses are being relegated. Don't just give up. The unfortunate thing is that we easily fold our arms and then relax. Of course, people will always, those that are ahead of you already, they will not want you to meet up with them. If you try, that is why the issue of follow-up, I keep on saying, don't just procrastinate. You just, you try once, and because you experience setback or you experience challenge, and you just relax. No, you can't progress that way. You can't achieve your objective that way. If you want to achieve your objective, you have to try and try and try again. That will bring success. Any achievement or any success usually starts within. It has to start. You have to, tell yourself that this is what I want to do. This is what I want to achieve. If I try the first time, I didn't succeed, I'll keep on trying until I succeed. I want our members to have that mentality, because this is a challenging period that we are in. If you don't have that mentality, if you just try once and then you fold your arms, you are going to be relegated, continuously to be relegated to the background. I hope I've answered that part.
Yes. Well, thank you very much, sir,
Thank you.
for this wonderful presentation.
Thank you.
May God bless you.
Amen. Thank you. Thank you, audience.